Hi, today I'm here with Dr. Philip Bomeli of Solon Orthodontics in Solon, Ohio. So I wanted to ask you, there's this crazy time right now of people not being sure when things are safe or not. So what about missing orthodontic appointments due to the pandemic?
So yeah, unfortunately, everybody missed appointments. We were all, down for about 6 weeks or so. However, the good news is we were still here for emergency appointments. So if anybody was uncomfortable or anything like that, we were able to take care of that. I had team members here every day, myself included sometimes, and we were, clipping wires and keeping people comfortable at the very least, which was really all we were allowed to do at that point. But the good news is we've been back up and running since May. Now we've had to do some things differently. Of course, we've completely revamped our schedule templates to do a variety of things to increase distance between each patient, physically and also time-wise, spatially. We've spread out appointments so that there's more time between appointments, so that there's less coming and going of patients at the same time.
So you've made these changes to the way your office looks. Can you point out some of the things that are in place right now?
Yeah, so normally our main treatment area bay has 5 chairs in it, and they are technically a little over 6 feet apart. However, due to an abundance of caution, I elected to make it so that we are seeing patients in every other chair, increasing the distance to almost 12 or more feet between patients and also technicians working on the patients, and myself. So we've done that. We've also completely eliminated most of the furniture in the reception area and converted more to a parking lot waiting room, if you will. And we have patients and their parents calling in to the office telling us that they're ready to come on in for their appointments. And we will tell them, okay, now's a good time to come on in. And we have one patient come into the door at a time. Um, and we've eliminated all, sort of amenities, if you will, unfortunately. So no magazines to read, no coffee station, no tea station. We've kind of eliminated that temporarily. We converted a room to a private room so we can see patients in that if there's special concerns or needs or things of that nature. All of our team members are, of course, wearing masks at all times. Patients and parents, anybody coming to the office wearing a mask. All of us, of course, are wearing masks, gowns to wear over top of all of our scrubs, face shields, all of those kind of things to make sure that we're extra covered up and safe and for everybody as possible.
So you've got the mask and the face shield.
Correct.
And are parents coming in with their kids, or are they asked to stay in their car?
So we do allow, because we recognize that some are younger, of course, we really leave it up to the parents. We say, look, we do allow one parent to come on in, or one parent or guardian, I should say, to come on in with the patient if they do desire to do so. Of course, to be masked up, of course, as well.
What's the protocol in between patients?
Yeah, so really, as we always have been following, all of the state dental board recommendations, all of the, everything as far as infection control is concerned in the dental world, which is actually one of the reasons I feel like we were able to open up relatively quickly compared to, a lot of other industries which may not be used to all of those infection protocols. But we do leave, as I was saying, increased time between patients, just again, a few extra minutes, more so to limit the coming and going of patients at the same time.
What do we tell our kids who have braces right now to pay heightened attention to minimize the number of extra visits to you?
Sure. So like anything, the more careful you are with what you're eating and how you're eating it, to minimize breakages and such, that would be fantastic.
Can you give us examples of what you mean?
Yeah, so a lot of times it's maybe not so much what you eat, let's say a carrot, for example, but maybe how you eat it or how it's prepared. A little baby carrot and, raw baby carrot, that's pretty hard, crunchy, chewy. Well, that can pop off a brace pretty quickly and easily, but it doesn't mean you have to eliminate carrots from your diet altogether. Certainly cooking the carrots makes them nice and soft. Matchstick carrots, there's lots of different ways to do it. And it's not, again, necessarily eliminating something from diet. Eating an apple, we would ask that you don't bite into an apple a whole apple like you might normally, but instead cut it up into smaller pieces, those kind of things. And that tends to really limit breakages and such. And if there's limited or no breakages, less need for emergency appointments, most likely. I do recommend, paying special attention to the retainers and keep them away from the dogs, and just keep good tabs on them so they don't get lost in the shuffle, if you will.
All right, last question. What do you want parents of teens to know?
I want them to know that we are committed to everybody's safety, and we're doing everything we possibly can to make it a comfortable environment for everybody to be. We appreciate everybody's understanding. Again, we're doing the best we can to keep everybody as safe as possible.
Sounds like you're doing a great job. Thanks, Dr. Philip Bomeli of Solon Orthodontics.
Thanks so much for having me.